All right, everybody, welcome. Tonight is going to be a really important conversation because I think what's happening with shockwave therapy right now is really much bigger than most people realize. For a long time, shockwave was mostly viewed through the lens of pain management. But now, what we're watching as it moves into a much bigger conversation, really focused on tissue optimization, recovery medicine, mechanobiology, regenerative support, and performance medicine. And honestly, this shift makes a lot of sense because helping people live longer is really incomplete if they can't move well, train consistently, recover efficiently, maintain tissue resilience, and preserve physical capability as they age. Otherwise, what's the point of getting optimized? And that's really when this entire or where this entire conversation really start to change. For those who don't know me, I'm Jeff Rubinoff with Dexa Plus. At Dexa Plus, we work with clinics all around the country, building longevity, recovery, regenerative medicine, and performance focused practices. And one of the biggest shifts seen right now is this growing focus on recovery as a foundational pillar of modern healthcare. Goes beyond shockwave, goes into other modalities, which I'll mention here in a second. So tonight, we're going to dive in to really what shockwave actually is. I think it's important for us to be able to differentiate and understand terminology. What is mechanotransduction and tissue adaptation, radial versus focal shockwave, and really there's some different platforms out there, and we want to really understand what we're using, why we use it, and what that technology really is or isn't. Treatment precision and why shockwave is fitting so naturally when you're doing HRT, if you're doing VO2 max training, if you're using a PEMF, if you're using red light therapy, if you're incorporating it into rehab, and really overall into your modern health optimization and longevity programs. And joining me tonight is Dr. Grove Higgins from Neuroathlete out in Colorado. Grove spent years in really deep development in movement, performance, tissue recovery, and optimization. And I really think this is going to be an outstanding discussion. Incidentally, Dr. Grove Higgins is one of our faculty at our shockwave therapy workshops over at the Anatomy Lab in Fort Lauderdale, Florida. And so, Grove, let's start here. Give everybody a little bit of a background on yourself, neuroathlete, and how you got pulled into the world of shockwave therapy and recovery medicine. Looking forward to it.
Fantastic. Yeah, thanks a lot for having me on. This has become one of my favorite subjects to teach on, and for a number of reasons, but especially being that I get to interact with guys like you and all the doctors that you bring out to Fort Lauderdale. It's always stimulating, and I hope I'm learning just about as much as I teach. So every time I'm there. But my name is Dr. Grove Higgins. I'm a chiropractor here in Colorado Springs, Monument area of Colorado, and I've been in the rehabilitation physical medicine field since 1988. I was lucky to get started early in my teens, and found something that I loved. Found the chiropractic end of things after years of doing physical therapy and athletic training with patients, because it enhanced the biomechanical model that I was using for rehabilitation and training athletes and such. And several years ago, 2017, I got into the field of shockwave therapy. It was kind of quite by accident. So here comes the fun story. I don't get to tell it a lot. So back about that time, I was working with a longevity doctor, a concierge medicine doctor who was, working in that longevity space. And he had a patient that came to him with some erectile dysfunction issues, and had read something about shockwave being helpful. So he comes to me and he goes, "Hey, Grove, I have no idea about any of this stuff. I know you're interested in researching. Hey, can you get some more information?" So I did. Reached out to a company that makes these things. They sent a person in a unit out within a couple of weeks of me inquiring, and said, "Here, use it." There were no protocols or anything, and of course, I really did not know what I was getting myself into. But in the course of that month of treating patients and doing, I'm really good with my hands, but the Shockwave allowed me to get results that my hands never could. For instance, getting into a joint, my fingers just can't get into certain places, and the Shockwave could. And very quickly after applying these treatments to my patients were telling me I need to keep this machine because of what it did for them. I've never had anything in my clinic that had such a robust and positive outcome, and a desire from my patients to have for them to use in my clinic. And so we bought two of them right off the bat. And yes, the gentleman who needed it for erectile dysfunction got excellent results in a very short amount of time. And in fact, he helped to fund the first two units that we bought. And so that's how I got into Shockwave. And ever since then, it has become a cornerstone of my practice.
Man, that's so great to hear. And I know, getting to know you over the time that you've been coming to our facility and doing hands-on training, you also really like to dig into the science, the technology, as well as the clinical part of it. And so we're really going to get into, a bunch of that today also. But before we do you think that recovery is really becoming one of the bigger missing conversations in longevity medicine?
Yeah, no, 100%. I mean, first of all, if a patient can't move, he cannot optimize. There's no way, because all of the systems of the body, hormonal systems and such, are set up to help an individual, that individual's body, to take the inputs coming into it, whether it be from nutrition or from exercise and just activities of daily living, and then adapt to them. So the recovery is really adaptation optimization, if we want to really look at it from that perspective. And so then individuals who are high users of their bodies or are using it very aggressively, like in sports, and I've got a lot of aged athletes, it becomes very important. And then especially when those people incur injuries that would normally stop them and take them out for a long period of time, the recovery piece for that alone is it needs to be a big focus of practice.
Yeah, I like that. And really, within the longevity space, I think, for many years, they really considered the emphasis has been more on hormone optimization, getting people to feel better. But like you said, missing out on this aspect of recovery. So you optimize somebody, really what happens next. And really, we're talking about quality of life, and then making sure that we're keeping people pushed definitely into that direction. Um, as we get into it, why do you think uh, more of the longevity centers specifically then, and performance clinics are now thinking of diving into recovery technology? Are they seeing something, different? Are the patients looking for it? Like what else do you think is really driving them to this?
Well, I think that they're becoming more aware of what is required. I'll use a really simple example. Somebody who comes and gets a DEXA scan, they find out they have low bone density, and they're told, take more calcium. Well, without load, the calcium is almost pointless, right?
Right.
And the same thing with exercise and trying to optimize weight, trying to optimize hormones and such. Those those are inputs into the system, but they need a stimulus in order to respond and react. And then when you realize that, then you say, okay, so how many different stimuli are there that we can put into play in order to get responses from these great hormonal therapies that we're doing, great nutritional therapies that we're doing, medicinal other things, the GLP-1s and all that type of stuff, how can we optimize that so we get the best effect? And there's only so many inputs that you can put in. There's quite a few, but there's electrical, there's movement, which is really mechanotransduction is what we're talking about. And then we can break that down into subcategories. There's chemical and hormonal, nutritional, and all of those types of things. So how can we optimize recovery? And the mechanotransduction component has really been kind of left to the side. Why? Because it's always been in the realm of I think physical therapy and training and such, and even into chiropractic as well. But there are other inputs that are very low level from a clinical application that are easy to apply, but that get high payoffs. And now those are all starting to come to the surface, and Shockwave being a significant one of those.
Yeah, and that's a really great point. And really what we're seeing, and we'll kind of dig into the concept of really what is shockwave therapy. The typical, you think about it, like I was saying in the beginning, focus and pain management. There's definitely also a big focus for erectile dysfunction. So it became kind of synonymous. People are thinking about shockwave, and they thought about ED. But pain management, big adaptation there. But to move within the health optimization space, and maybe it's a slight, it's important. They have the patient base. Should they, be worried about using this technology in their practice? I mean, is it typically in the wheelhouse of the PT, the chiro, or the pain doc, or, in the health optimization space? Is there anything that they should say, hey, let me refer it out? Or is it easy enough for them to do in their own clinic?
For most things, I mean, I suppose that if you were talking to somebody who needs, we'll just go to the erectile dysfunction example, that is not well schooled in that area, you're going to you're going to be inefficient. We'll just put it that way. And so then referring out for something specific like that, if that's not part of your wheelhouse, it's not something that you do in your clinic, things like that, for sure. And then there are other individuals who deal with certain aspects of injury. So myself, I see a lot of individuals with facet and disc mediated pain, which it's a bit of a nuance. And just treating it with one modality that you have that could be very effective is great, but there needs to be some add-ons to that immediately afterwards. Otherwise, you're kind of leaving the patient partway there, and they're not going to get full recovery. So then in those cases, referral out is fantastic. The beautiful part about Shockwave is that it is extremely safe. Can you irritate the system? Yes. Could you injure it with some egregious misuse and overuse of it? Yes. But for the most part, being the class of modality that it is, it's extremely safe, and it's easy to employ on many different patient populations for many different maladies, and with many different levels of knowledge and clinical application behind it.
Mm-hmm. So bringing it in, typical, give an idea of maybe some of the common uses, from, I don't know, like a tendinopathy to a plantar fasciitis, or we can make it even simple: foot, ankle, knee, elbow, shoulder. Like, what would be some of the, specific application and some of the outcome that you would anticipate?
Muscular injuries, strains and tears, and contusions, and some of those could be even post-surgical, for that matter, not necessarily just from use and abuse. Overuse tissues as well, granulated tissues that have occurred over a long period of time, such as your carpal tunnels and muscular fibrotic tissue development. This is fantastic for that type of thing. But like you were saying, any of the tendinopathies like lateral epicondylitis and rotator cuffs and such like that, and even down as deep as facets in the lumbar, which are 5 centimeters deep at the minimum on most individuals, and much deeper on others, to the deep hip joint and the acetabulum. but we're even able to get inside of the glenohumeral joint into the labrum, so the deep fibrous tissues that typically do not respond well to most treatments externally, outside of things like PRP and bone marrow concentrate, which is fantastic, but it's costly, and sometimes it doesn't need that level. So we can intervene with Shockwave as a yes, it's a recovery tool, but it's also a regenerative medicine tool. We're actually seeing regenerative effects from it, so we can get into joints that have damage pre treatment with regenerative medicine techniques, as well as pre-surgical, as well as post-procedural as well. And tendons, though, are one of the first places that it was qualified or certified for use by the FDA, and it does fantastic there. And some of those are particularly hard to recover from.
That's it. And I've seen some amazing outcomes, using shockwave therapy, and they're typically fast sessions, typically 8 to 10 minutes.
Yeah,
What would
typical treatment for me is 6 to 8 minutes is really what it is, unless I'm covering a large area. But for the most joints, 6 to 8 minutes is my average.
Yeah, and that's amazing. And people leave feeling great, right? Not everybody, but what a large percentage of people from that one treatment walk out feeling great. And we'll get into the technology. I'm sure people are wondering, okay, let's get into the science of what is Shockwave. But if we look at it from an application perspective, and again, ease of application, so 6 to 8 minute sessions, and typically 5 or 6 sessions spaced about how far apart?
I like to see my patients have a objectively positive outcome within 3 sessions, so that way we know we're treating properly, right? And oftentimes we get positive responses within 1 session, which is nice. But I have patients buy into the idea that the 3 to 6 sessions is what they need to invest in, and then from there, depending on it, it may go beyond that. But I don't see oftentimes needing to go beyond the 6 to 10 range maximally. But I have other patients that once they feel that experience and they've had the pain that they had prior to that, they don't want it coming back. And so they're willing to invest beyond the need.
Right. And keep going. And typically, if you're over healthy tissue, you're not going to feel the treatment.
Yeah, that's very true. If you know where you're at and you're applying the right application, the feedback is while you're in treatment, the area of pain is pronounced, and the patient will help you find where it needs to be. You just have to be a smart enough clinician to know your anatomy, to know your depth, and to apply the right technique behind it to start to get a result. The patient will help you zero in on it to the point that they're like, that's it, and be able to reproduce the pain patterns. And they're usually very happy with that, even though it was uncomfortable while we were doing it. They know you were doing the right thing in the right place.
That's it. Awesome. All right, so let's dive into the technology. That's why we really want to figure this out, so there's no misnomers and no misunderstanding of what Shockwave is. So really, the foundation. What actually is Shockwave therapy?
So
Clinically speaking.
so shockwave therapy is using high pressure sound waves to create a shockwave. This is where those sound waves are coming together. It creates an area of high pressure that then creates a cavitation. Cavitation being that as that high pressure area resolves, it creates a cavitation where you have a release of gas in that area that indicates the release of that energy, and that area is the area where the most energy is being released, and that stimulates the tissues where that energy is being deposited in. That stimulates the tissues, and depending on the cell types that are there, each of them have multiple sensors on their cell membranes that respond to this mechanical input. So, and that mechanical input could be anything from hydrostatic pressure, so that's that cavitation primarily, tensile forces and stretching and shearing forces. And in doing that, those cells then respond to that. Now, what's really happening here, though, is that the cells are assuming that that input was potentially an injury. So the response is one of recovery from a potential injury. So it's a hormetic effect is what this is called. So where the body is put under stress, or the cell is put under stress, and its response is to do its job better in order to help this body recover from this a supposed insult that it just had from this high pressure sound wave that just came through it.
So, from that perspective, it's really interesting because as we look out there, kind of in the scope, there's some companies out there promoting their shockwave therapy devices to the point where they say, "Oh, you don't feel anything, therefore it's a good thing." And so how would you like put that into perspective? Where pain tolerable? Should you not feel it? Should you feel it? Like, why is that significant clinically and scientifically?
Well, two things. The body responds really well to large inputs, right? So like when we're doing hormone therapies, right? We're not doing a one-for-one input of testosterone, say, into the body. There's a large input periodically, right? If you're doing microdosing or if you're doing pellets and such like this, there's one input, and that kicks the body into a response to that large input, relative large input of hormone. Same thing with protein. If you take in a large bolus of protein beyond, say, 40 grams in one dose, and higher is even better, you get not only the taking of that protein and utilizing it in an anabolic way, you get an increase in metabolism. So signal is important. This is what this really comes down to, is signal. What is the signal? So I can take something like a massage gun and I can massage tissues and help to encourage recovery. Or I could give this to my patient and do it. But this is a low-level input that if I'm going to charge $150 to $200 for, I better be getting a really robust response. Now, the shockwave, goes beyond that. And so the idea of having a pain response is important, because that pain response triggers a whole other set of cascade of chemical responses in the body that gets something that not having pain doesn't get.
So the comparative of shockwave therapy versus a Theragun or therapeutic ultrasound or e-stim or just vibration or these massage devices out there. And most health optimization practices probably aren't going to have that, and they're looking to boost their recovery. But that could be a question. It's like, all right, you're doing this, you're delivering acoustic sound wave, but I'll just send the guy to the guy down the street that's using therapeutic ultrasound, or maybe I'll just use an e-stim. Like, what would the big distinction be? And I think you just said it, but just to kind of clarify as a comparative nature against some of these other, and the Theragun as an example.
Right. Yeah. Sorry, I had to get some more light in here. I was realizing it's getting dark out there. Yeah. So again, there's multiple inputs. The cells each respond to lots of different things, and the research really does show what gets the biggest bang for your buck. If you're going to spend the time and the money to try to get a robust response from the body, pick the right modality, and then you might support somebody by having them go out and get a massage gun so that they can do lower level things in between times. But that's where, that's the differentiator between shockwave and other things, is that we are the number of research papers on this subject is growing exponentially now, year by year, and on every continent of the planet, just about now, and it's showing a better than most clinical modality responses that are out there. So again, it comes down to, if you've only got so much room in a clinic, And you've got to pick a modality that's going to get your patients where they want and bring them back. The Shockwave really does take the cake in that.
Yep. And it's amazing. So if you dig in more, I guess, scientifically, right? What is the scientific uh, evidence, or what is the causation of the acoustic wave? What exactly is happening? You mentioned a little bit, as we're kind of waking up the signaling, but as we're delivering this acoustic wave, creating the cavitation, what's that signal after that? That's occurring, that's generating those clinical outcomes. And
Yeah.
there are devices out there that might not deliver cavitation, but yet are still claiming to be shockwave therapy devices. So
Yeah.
is energy significant? Tell us a little bit more along those lines.
Yeah, definitely. And I can tell you how it happens, and we'll get to kind of the difference between machines and everything. But I think it's important to say, what's really happening at that cellular level, and how does that tie
Right.
into the longevity optimization field. If you can
Yep.
throw up that graphic.
Okay.
So all of these, comes out of a paper from China, and a couple of others that are incorporated into this. But what's happening with each of these different cell types, and this is not exhaustive, of course, but from things like stem cell proliferation, Swan cell function, endothelial cells, and anti-inflammatory and anti-inflammatory cytokine regulation, and cell-gated sodium channels. We get different effects from each one with one modality, which is really cool, because then we can purposely target areas where these are concentrated. So I'll take just the stem cell proliferation. If you have got an area of injury, right? So whether it be surgical or just a typical injury, or a regenerative medicine application where they've done bone marrow or adipose derived stem cells, those stem cells there need stimulation in order to create cellular regeneration in that area. So you're trying to get them to enculturate, proliferate, and then start to remodel the tissues and create the tissues that you want. And so you can see here just underneath that we get an increase in several of the factors that are coming out of these cells, such as transcription factor, cell cycle progression. So pushing that cell to become a new cell type, such as new ligament cell or new tendon cell, which you're trying to repair, right? Proliferation, migration from the outside of the cell, of the area, the tissue, into the tissue from the blood, things like that. All the way down to this voltage gated and sodium channel area and the blocking. Well, this is where we get analgesia. So we can use the same device to stimulate all of these different types of cells and get everything from tissue repair and regeneration to analgesia, and helping the patient with their immediate pain problem and get them back out and doing activities of daily living and athletics, for that matter, which is going to make them better.
Which is the ultimate goal.
Which is the ultimate goal.
Yep. So, just to, I guess, really to go back, we want to connect now. We want to connect biology, the science, all to recovery and adaptation. And maybe there's providers that have heard this term, mechanotransduction, for the first time. And if I'm not sure, I mean, it's possible, but
Yeah.
if you can
No,
kind of get into, what that means and, what that is in reference to.
Yeah, so here's a really basic model that I think just about everybody can get behind. This is the basic what's happening in mechanotransduction. Every time you touch something that you put force through a joint, so in this case, running or gating of any kind, you are putting mechanical force into the system, right? That mechanical loading stimulates the extracellular matrix to create new cellular matrix, which then strengthens everything. So you're getting specific adaptations depending on the type of input into the system. It's called specific adaptations to impose demands. All right. The whole body operates on this principle alone, right? Now, how you do it can be very nuanced from, because we're all doing things like gating. So we're walking, we're running, we're doing things like that, or lifting weights and such. But it's very imprecise as to what response you're going to get. You're going to get specific adaptations if you target specific tissues, but how do you help that specific tissue to develop past a limitation, such as an injury, and be able to enhance that area and get better response from using the mechanotransduction. So the mechanotransduction is basically the only thing that you're doing is that you're putting in these simple, different inputs from hydrostatic pressure, tensile forces, shear, and stretch, which are all mechanical inputs into the system, and turning them into cellular biochemical events, signaling.
Mm-hmm. So would you say that, many of the chronic tendon and connective tissue problems essentially are tissues that may have stopped adapting properly? Is there?
Yes, yeah, because a lot of times we'll just take, a tendinosynovitis type of problems, where an injury set up, whether it be from overuse or strain or sprain of a particular system, and it sets up a series of inflammatory responses. Sometimes those inflammatory responses and some of the tissue adaptations can self-perpetuate the injury cycle. And so then the patient has a hard time escaping and healing from their particular problem. And so what we're doing is we're speaking the language of the body. We're doing biohacking, right? That whole word. It's basically speaking the language of the body to get it to do what we want it to do.
Yep. So chronic conditions are essentially biologically stuck, so to speak.
Yeah. I mean, yeah, definitely. Especially, the most common one are the repetitive motion injuries, and it isn't just carpal tunnels, but a chronic bad posture. I mean, that who doesn't have that, because we sit way too much in our Western society and such, and so then you're going to the massage therapist every week or a couple of weeks to get worked on, because those tissues have lost their health, they've lost their resiliency, their ability to perfuse oxygen, because blood flow is poor now, because there's such a high amount of fibrotic tissue within a healthy tissue, once was a healthy tissue, is hard to break. And you can only augment your environment so much. That's ergonomics. You can only stop your work and stretch and do exercise so much. And so we get stuck into these cycles, and they start to build on top of each other. And so we need something to kick the system forward to get it to start responding in a more positive and robust way that then allows the patient to get ahead of the problem.
Okay, and that would be shockwave therapy then.
Shockwave therapy is my go-to. I mean, I still use my hands, but the shockwave is just it's a bigger bullet in my arsenal.
It's a clear adjunct. Would you also say that it's fair to refer to shockwave therapy as a non-invasive regenerative therapy, or even a non-invasive PRP, quote unquote?
Yeah, 100%, most definitely. One of the most common things I see and that I refer out for those modalities is things like meniscus repair. The biggest problem with a meniscus is that, of course, it's an avascular tissue, like ligament, like tendon, and such. It's largely avascular. And the problem with that is that then those tissues don't repair completely, and then they start to degenerate rapidly. And the shockwave helps us to amplify the signal to get, especially locally, because we're not applying this to the whole body, we're applying it to specific things, to get a very robust localized response. So this study here in particular, this is a mouse study, but we see this in our clinic quite often. In fact, I'm part of this story myself with the meniscus injury, where this is the mice were exposed to a surgeon's surgical tear of the meniscus, and then shockwave was applied to one group of mice and not to another. The top set of images here, this is a meniscus tissue that has the surgical tear similar to the one below it. Shockwave was not applied, and you can see it start to degrade and disintegrate, right? We see that in human beings as well over time. In the bottom one, the same surgeon doing the same surgical application, the tear to the meniscus, one shockwave session at 2 weeks, and then we start to see at 4 weeks, we start to see a reknitting of that meniscus tissue to the point of at 8 weeks, after one application, we start to see a completion of that tear. So a regeneration of an avascular tissue. So this is in laboratory conditions, of course, I understand, but we're seeing this in our clinics.
Well, you said after one treatment.
Yes, correct.
So, I was going to ask you this question later on, but perfect timing for the question. One of the things that I've noticed is you could give somebody a treatment, they'll have a treatment, and a week later, still full range of motion, pain free. 2 weeks later, 3 weeks later, some might be a couple months, maybe
Yeah.
even longer. Up versus, there's other people come in and you give them a session, and obviously you want to make sure you have the cadence before the healing cascade. And maybe we can talk a little bit about that. Why is it then that there's some individuals that might respond like that, where elongated periods of time where they seem to have full relief, versus others, and maybe severity of injury would have to have it more, scientific with imaging, but others that, where it's coming back sooner, or what
Yeah.
exactly would that causation be? Like in this instance, one application, and we're seeing, an 8-week recovery. If they did application in 5 sessions, do you think it would have shortened that duration? What is happening overall, from a
Yeah.
scientific and clinical perspective?
So just like all of your other therapies, selection criteria of the patient is really important, right? If somebody is metabolically not well, it's going to take more work. It's going to take more application, more signal to get the response that you want, right? Because metabolically sick individuals or metabolically less optimal individuals just do not respond the same way versus someone who has is robust in that aspect, right? So I typically see a faster response from healthier individuals and less so from a less healthy individual. The second thing is, being very selective with your application gets you very precise results. If I do a good job of identifying where my lesion is, what the lesion is, where the depth is, all of that, and then select between my various modalities, the right modality, I'm going to get a better response than if I just kind of guess and hack at it. Now, the guesses and hacks, that's how I did it for many years because I didn't have a diagnostic ultrasound in my office, which that's changed a lot. But I've gotten very good at selecting my shockwave modality and how to apply it. And so that also plays into that discussion, how quickly you get responses and why somebody responds very quickly than others. And then to answer your question on the mouse study, would this have gone faster if there were more applications? And the answer to that, I think, is yes. We see at least a 72-hour cascade of responses after an application of shockwave physiologically. This is looking at it histologically and the different responses that are coming from the tissues for 72 hours. And so we want that to kind of run out, as it were. So if we can reapply at the end of that 72 hours and keep that moving forward, right, and keep it progressing, then we're going to, and we do get faster responses from it. But we find really good responses even from once a week for these individuals. And it depends on the injury that we're talking about.
Right. I find it, absolutely fascinating, when we start seeing these types of treatments. And then I guess as we get into it, some of the, key, uh, from a clinical perspective, clinical talking points, key clinical talking points, fibroblast activation, collagen remodeling, cellular signaling, mechanobiology, tissue adaptation, controlled stimulus. There's all these, things that are going on within the movement, which is so much more than, hey, if you're just doing massage therapy or a Theragun. And again, if we uh, kind of get into some of the key points of that healing cascade, what are some of the key components of the healing cascade? So we're seeing this happen, and we're looking at this period of time over the 8 weeks. We're applying the shockwave. How is the body responding? Like what's happening specifically that the shockwave therapy is helping the body or stimulating the body to do? Is it
Right,
inducing the body or stimulating the body? So it's not the shockwave itself that's the treatment, right? It's the shockwave is the awakening of the body's response, with
right,
for the healing cascade. Is
right.
that is that
Yeah, yeah.
accurate? Okay.
So going back to this one here, when the the mechanical transduction is doing a few things. One, we're increasing metabolic activity right away, right? And so that immediate need for more oxygen in the area that has just been stimulated is going to bring more blood into the area to create a more oxygenated environment for those mitochondria, because that's really what is asking for the oxygen at that time. The next component that starts is and starts right away is this release of this substance P right here. So this is substance P is an output from free nerve endings. So nociceptive pain sensing nerve endings being stimulated by the shock wave, and that substance P already starts the cascade of pro-inflammatory cytokines and macrophage activation in order to get the tissues prepared for recovery. Over the long term, we start getting a release of VGEF. So if you go to this epithelial cell recruitment and migration, VGEF, that's vascular epithelial growth factor, it's already starting to build new blood supply into that area. So whether it was damaged blood supply or it was poor blood supply to begin with, again, think of like the repetitive motion tissue, it has really poor blood supply. We're building new bandwidth for a new pipeline for blood flow into that tissue, which then increases perfusion and it helps the increase in healing. But then we're also stimulating the whole regenerative effect of bringing stem cells into the area and then stimulating those stem cells and such. So we're really speeding up what would have happened over time. Normally, we're speeding that up, but in particular into areas where the conditions weren't optimal to begin with. You think of something like a cut on the skin. It already is very highly perfused with blood supply. It forms a scab. It creates scar tissue. And that scar tissue can become like everything else around it to the point that you don't know you can't perceive a scar there anymore over time, right? And what we're doing with the shock wave is that we're doing that to tissues that have poor blood supply or no blood supply, or very relatively no blood supply, and setting them up for success where otherwise we would have to go to a exogenous system of either surgical or regenerative medicine applications, which still oftentimes, still yield the best results, but combined with shockwave produce even better results. And we're seeing that quite well in the regenerative medicine field.
Yeah. Now, it's really amazing, because some of the things that, people tend to just let's just kind of go general medicine, And then I want to kind of bring this into the longevity recovery stack that I think is important. But typical traditional medicine, the fast fix for pain, tear, is either going to be a steroid injection or surgery, right? Whereas our objective is to help optimize someone and help prevent steroid or surgery, right? That would be the ultimate goal. Now, if we have somebody coming into they're getting optimized, they're feeling great. One of the things that you brought up, I think, really important. You want to have someone that's in an optimized condition to get the best outcome. Uh, One of the areas that I've noticed more discussion in that's outside of the typical health optimization space is on the regenerative side. So the
Yes.
reason why I brought up kind of the traditional kind of sick care environment, fast fix, injection, put a steroid in it, lead them to surgery. Whereas the regenerative field seemed to be very procedural based as well, where someone comes in, okay, I'm going to give them an injection, it's going to be PRP or bone marrow or a stem cell or adipose derived stem cell. Great, you'll get some great results. But now we're starting to also see more discussion uh, and more evidence coming out that there's a more positive outcome, potentially better outcome if the patient is optimized in advance, right? If
Uh,
they're not you're not delivering sick blood, and if you can even use Shockwave as an adjunct to all these therapies.
yeah, no, 100%. I'm starting to work with a doc who's moving from the ER side of things to the regenerative medicine side of things, and that's where he really wants to leverage things is become a optimization clinic that then offers regenerative medicine because the outcomes are profoundly better for those individuals. They heal that much faster, that much farther, and much longer.
So the health optimization space, they're like it's a massive opportunity to bring in shockwave therapy, my opinion, mainly because they're in process of helping somebody kind of regain. They're helping them optimize. And now some of the things that you brought up, they're running into a so-called brick wall because they have age-related chronic pain or overuse condition. So now we're talking about joint, tendon, all the typical things, and it's preventing them from playing tennis or golf or pickleball or playing with the grandkids or the kids or all of these things. And do they optimize? Do they want to go to traditional, get a steroid injection or surgery, but they're kind of in this great spot in these health optimization longevity practices to bring Shockwave in. I mean,
Almost.
yeah, what are your thoughts on that whole kind of picture? To me, it seems very intuitive.
Yeah, it is very intuitive, and of course, the patient needs to understand that, and that's where health optimization and longevity practices go do much better than the typical medical practice. They educate much better,
Right.
and this feeling of empowering patients with resiliency within their own body, with information, and then with the tools to back it up just makes them that much again much more empowered. They're more they'll tend to be more active, more proactive, and they're always going to come back to the source that they trust that gave them that ability.
Right. Before we kind of get into, I want to talk about, stacking modalities. We can talk about the positive benefit of shockwave therapy and as that fits in as an adjunct to or stacked with other therapies. But just as a point of reference, if somebody came in and was to get a steroid injection, right? They're suffering and they say they were in pain. What do you do with a patient like that if they've had a steroid injection?
Yeah, so this is where the sad part about that situation is, and hopefully it's helping them, of course, but if it's not, the shockwave is going to have the effect of driving that corticosteroid out, and so we need to know what phase that they're in that therapy. So we need to see a non-responder even after a good week, maybe 2 weeks before we apply this, because we don't want to muck up the situation. The other thing is how chronic have they been on this steroid? If they've had multiple applications of it, the tissues are very friable. They come apart, and so they're not healthy anymore. They're not healthy tissues, and so again, this is where we have to kind of go in, help the person clear the steroid, start to build them up a little bit with maybe some loading of other things like eccentric load on a on a squat or whatever the body part is. An exercise that stimulates that area starts to engage those tissues that have been degraded because of corticosteroid use. And then things like the Shockwave can then really help to speed that process up. But we got to know what they're being treated for specifically, what stage they are in the treatment, how long they've been treated for it, and such. I think that's pretty common with just about any medical application. We need to figure that out first, so that way we're not endangering or confounding their treatment.
But ideally, we get to them before they have the steroid injection.
Ideally, right? Yeah.
What are some of the, I think this is important, from for a provider to have some clarity help provide clarity to their patient that's considering a steroid injection. And if we're in the health optimization path, hopefully that client or patient isn't moving in that direction. But what are some of the bad implications, the negative implications of a steroid injection that we can, with shockwave therapy, we can help them avoid?
Yeah. So, I mean, the steroid is going to lead to more rapid degeneration. That's just the way it is. The doc who is applying it is hoping that it's going to get them over the hump and they'll be back to normal, and then they can rebuild the tissue. But the application of it is going to speed up degeneration. So, of course, if we're able to get together with them, we're going to reverse the environment that the injury is persisting in, and speed up the body's response to heal more completely that part. And then at the minimum, like you've already said, some people respond very quickly. Turn off the pain so that they can do the other things that they need to do to get healthy again.
Right. Yeah, I like that a lot. So one of the areas that we're seeing a lot of movement into is a stacked recovery ecosystem. So we go through, I look at the multiple pillars, get into a health optimization practice, and we have the metabolic pillar. That would be DEXA imaging for body composition, visceral fat. We're looking at lean mass, body fat, visceral fat. Then if you stack or pair that with resting metabolic rate plus VO2 max, you have a very comprehensive picture, plus the blood work that they're already doing. But then from there, they get into their programming where they might be doing HRT, they're doing peptides, they're doing nutrition, exercise. But then we have our recovery pillar. And within recovery, things like PEMF, pulsed electromagnetic frequency therapy, red light therapy, and hyperbaric. And then that puts us into therapeutic, which would be more shockwave therapy and PRP and orthobiologic. But what I'm seeing a lot of within the health optimization longevity space is stacking the recovery. So we're starting to see modalities that are bringing the clients into their practice as a destination. So red light therapy, it's easy. Someone comes in, they're on the red light therapy bed. PMF, amazing. Also, shockwave therapy. Talk about how some of these modalities could potentially work together. Why they may offer them together. Like, why would you do shockwave and then red light therapy after, or why start with PMF potentially, then shockwave, or would you do shockwave and then PMF? Like, have you had experience with that and see, how that, some of the stimuli or more positive outcome and impact on the client?
Most definitely. The stacking is important because they all have overlapping functions to a certain extent. If we turn this into a Venn diagram of what each of those modalities do and where they overlap, that synergistic space in between them all is where we're getting the amplification of that. I hate the overuse of the word synergy of all of these modalities together. And so, what you can put in, but the other part of it from a clinical standpoint is what can you put into the mix that also is somewhat more passive, where it doesn't require me to apply it, right? And it doesn't take a highly trained medical technician, that the patient may be even able to do themselves because you have the modality for them right there as well. And then anything else that you put in better be an amplifier. Otherwise, you're wasting time, you're wasting money. Is it just a feel-good thing, or is it actually adding to in a multiplicative fashion for the patient?
Oh, that's interesting. How would you really discern between the two? Where would you go? Is it just feel good, or is it impactful and helping?
Oh, I mean, the research is out there, and it really, really is. Some of the stuff that's very popular is a little bit more anecdotal than laboratory driven. Shockwave is very has got some really good hard science behind it, and that's growing again by itself. HRT, of course, we know exactly what's going on there and how that applies, nutrition and such. Red light therapy, that's coming up, and that's got actually a lot more research to it than before. But what it comes down to is get into the research. Is the research there? Is it objective? Is it coming from good sources and such? And then I'll tell you what, and this is my new source, is talk to guys like you who are out there, who have got their fingers in the industry, that are finding out what are all the doctors using, what's really working, what is BS, and what needs to be ignored, and what's a snake oil, and start stacking them, because you guys are interfacing with more doctors than most of us will, even in a large conference. So it's easy.
Yeah, that's a great point, which is why I love doing our training sessions when we bring providers from all over the country to sit in. We have our small group training sessions at the anatomy lab, 20, 25 providers, and then our faculty, staff, and everybody just watching interaction and networking and conversation. I think sometimes goes beyond the educational part, because it's long-term networking experiences, friendship and professional that are derived from it. But just that knowledge base, we get a lot out of that, out of a 2-day session, but then it's the ongoing experience, I think, from having, expanded conversation, and then also seeing from a clinical outcome perspective, just we do get a ton of feedback, which is, very, very positive.
Yeah, I learned so much, and it's a wide variety of practitioners that are at those trainings, and so coming at some of the same information but from different perspectives, so you can't help but learn.
Yep. So just, I guess, as to sum things up, some of the things that we covered today from a clinical perspective: chronic pain, tendinopathies, aging athletes, mobility loss, recovery optimization. I think those are some of the key points that we talked about today. Uh, I guess, as a final wrap up, and to look at maybe the future of regenerative medicine and recovery medicine. I guess, just as a final question, if there's one major takeaway that you want providers to leave with tonight about shockwave therapy and the future of recovery medicine, what would it be?
Yeah, I mean, the future is it's regenerative recovery, movement oriented. It's performance driven type of care, which is a lot of work on both sides of the equation. The patient side, the patient has to do their part, you have to do your part. But the goal isn't merely to help patients live longer; it's to help them improve their physical capabilities and resiliency and activity and such like that. So. What it comes really down to is, what can we do that helps to empower the patient, get them to the point where they can do the things that they need to do, that take all of the therapies that the docs are putting out there and applying to them, the therapists are putting out there, and make the most of it. And if a patient's not moving, they can't optimize. And so that's where Shockwave really shines. It has a lot of other applications too. But myself, I'm a movement-based therapist. If I want to be totally honest, my whole job is to not just get people out of pain, but to make them move better, and that ultimately leads to healing. And so Shockwave is my main cornerstone modality that I use now.
That's awesome, man. I really appreciate you joining me tonight and joining everybody tonight for this great in-depth conversation on shockwave therapy and really how shockwave therapy is reshaping longevity and performance medicine, across the board. And thank you, Grove, for being with us here tonight. Dr. Grove Higgins, neuro athlete out in Colorado, and this is Jeff Rubinoff with DEXA Plus. Thank you again, Grove, and we'll see you guys on the next webinar that we put together.
Thanks for having me.
Have a good one. Thanks.